Osteoarthritis is a progressive degenerative joint disease that is very common in dogs and cats, and it can occur for a multitude of reasons. In order to properly manage osteoarthritis, it's really important to take a multimodal approach to your therapeutic regime. Multimodal just means we're going to use many different approaches to be able to best manage this disease in a way that's going to give our patient great quality of life long term, not just short term, not just in the now. So osteoarthritis, we all know, responds really well to non-steroidal anti-inflammatories. It would be so easy to only use non-steroidal anti-inflammatories. Here's a pill. Go, your dog will feel better. Also, by just putting the dog on non-steroidal anti-inflammatories, but then not putting a change, not affecting their exercise program and perhaps weight issue, we're not helping the joint. We may actually be exacerbating the damage to the joint by allowing the dog to be fat and sedentary or not having appropriate type of exercise. So we're really not doing our job when we just say, here you go, give him this drug, let me know if there's a problem. Using a multimodal approach, we can extend the life of the joint, improve on the pet's quality of life, and decrease on the amount of medication that the pet needs to take. My goal always when managing osteoarthritis is to be able to have them maintain the activity level that they enjoy and be drug-free for as long as possible. That's our job as veterinarians. It's not just to hand them a pill. So let's go out and help more dogs with osteoarthritis.